Have you ever thought about chin liposuction, but were curious about the timeline? Hi, I'm Dr. Dominic at Elite Facial Plastic Surgery, and today I'm going to talk to you about the timeline associated with chin liposuction. So what is recovery like on days 1 and 2? Obviously, if you move forward chin liposuction, you have your procedure. On that first day of the procedure, you're going to leave the office wearing a garment. That garment normally velcros, basically supports the submental or chin area, and then velcros the top of the head. Now, you'll normally keep that on anywhere from 24 to as long as 36 hours, depending upon how much swelling you have. But certainly after post-op day 2, I normally recommend just wearing the garment when you're at home for about 4 or 5 hours during the daytime and when you sleep at night for another week. So what is recovery like 1 week post-op? After you get to about a week out, wearing the garment is entirely up to you. And at that point in time, you can certainly resume your normal activities. What is recovery like at 2 weeks post-op? One of the key recovery points will be at about 12 to 14 days after the procedure. At that point, you'll start to notice some contraction that starts to occur in the tissues, and it may start to feel a little bit lumpy, bumpy in the neck area. I normally see my patients during this follow-up period, and I advise them to massage the area, but I recommend doing any kind of massage to the neck area very gently. And normally you can do that from about 2 weeks out to about a month. What is recovery at 1 month post-op? From a month to about another 4 weeks to 2 months, the area will be settling. Now, the incision itself normally takes about 6 months to fully mature, and I've covered this topic in a separate video in my library. So when should you contact your surgeon? One of the things that I always tell patients is that if you feel like something is abnormal, and things that are normal are going to be redness in the area, increased swelling, certainly any pain or fevers, those are symptoms and signs that you need to call your provider immediately. Normally, after the day of the procedure, the soreness should get less and less and less. At any point, if it starts to become more swollen, more red, tender, or fevers, you need to let your surgeon know because there's always concern for infection. So this brings me to best practices to have a smooth recovery. As with any surgical procedure, it's really important to eat well. And what does that mean? Eating vegetables, good proteins like chicken, avoiding carbohydrates and sodium, and then certainly do not smoke, do not drink any alcohol. And then from an activity standpoint, you need to follow your surgeon's instructions to the T so that way you don't have any problems, because sometimes people can do too much activity. In doing so, that can compromise the result.